Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you another fascinating guest today involved in creating a better tomorrow. Today, we have the honor of being joined by Dr. Renee Wegrzyn, who is the first inaugural director of the Advanced Research Project Agency for Health, otherwise known as ARPA-H. She was just appointed back in September 12th of 2022 on the 60th anniversary of President JFK's moonshot speech. And the organization was formed to ultimately support the development of high-impact research to drive biomedical and health breakthroughs, to deliver transformative, sustainable, equitable health solutions for everybody. Previously, Dr. Wegrzyn served as the Vice President of Business Development at Ginkgo Bioworks and Head of Innovation at Concentric by Ginkgo, where she focused on applying synthetic biology, focused on infectious diseases, including COVID-19, through biomanufacturing, vaccine innovation, and biosurveillance. And prior to Ginkgo, she was a program manager in the Biologic Technology Office at DARPA, where she leveraged the tool of synthetic biology, gene editing to ultimately enhance their biosecurity portfolio, promote public health, and her DARPA portfolio was extensive with a variety of their programs, including focus on 1,000 molecules, safe genes, the gene editing technology program. Dr. Wegrzyn holds a doctorate and bachelor's degree in applied biology from Georgia Institute of Technology. She was a fellow in the Center for Health Security Emerging Leaders and Biosecurity Initiative and completed her postdoc training at the Alexander von Humboldt Fellow in Heidelberg, Germany. We're honored to have her with us today. Dr. Renee Wegrzyn, thank you so much for taking time to come on the show.
Ira, thank you so much for having me. Really excited to be here. And you can call me Renee.
Well, it's great having you, Renee. I'm so excited about this and about your appointment. I would just love to start off because, when we've seen a lot of you at the news lately with the announcement and learned a lot about your career in the public. And, whether it was your time in private industry working on things like Alzheimer's diagnostics or biosurveillance, your time at DARPA, even during your Ph.D., there was this unifying theme there. I mentioned it in the bio of applied biology, of taking these tools and technologies and finding practical uses for them. Take a little time, just if you could talk a little bit about this theme of applied biology and why it's been so important through your career and especially now with what you're getting into.
Absolutely. Well, I think, I always had a love for science early on. I grew up in Florida, close to the beach, and, used to like to explore the beach and all the critters that I would find along the way. My sister was a scientist. She's now a lawyer, but she started as a scientist. And so that was an early introduction for me. She's 11 years older than me. So early introduction into the sciences. And when I decided to go to Georgia Tech, I loved the school. I loved the idea of bringing together engineering and biology. And I didn't really realize until I got out of Georgia Tech how much they gave me a lens of progress and service is their motto. So you work on science not for the sake of science, but actually to make the world a better place. And so that's really something that I took with me, all throughout my career, as many others have, of course, as well. But it was that foundation that I think just really I learned science from a different perspective because that was the core and the foundation of it.
Excellent. And most recently, as I mentioned, you were at Ginkgo. We had a couple of weeks ago, we had David Markowitz on from ARPA talking about the Felix Biosurveillance program, which you were the other side of that. So you're hanging out at Ginkgo. your phone rings a couple months ago, and the president's on the phone saying, Renee, we need you. We have high potential, high impact biomedical research that has to get done. We're setting up ARPA-H. Come on over. Introduce us a little bit to sort of how, because it's been in the works for a little bit. We've heard a little bit about it in the wind the last couple of years. Talk a little bit about sort of where ARPA-H is right now, where you are, where it sits within sort of the NIH structure. And I know you're just getting started with, hiring some of the program managers. So unlike the DARPAs and ARPAs, you got to start from scratch with this one. But take us through a little of the background of what's been going on since you were appointed this role.
Yeah, well, as you noted, it's not really a new idea. It's been around for a few years, but finally got traction. Last March, the president announced that he would launch ARPA-H. And so, much to my excitement, really watching it unfold and then eventually being invited. And literally, as you described it, I was at work. I was on a Zoom call and I got a phone call, turned my camera off and mic to take the call from the president. And so it was just really, really exciting to be invited to do this incredible service for my country and hopefully, be a catalyst for patients everywhere and healthy individuals everywhere. And really the patients are waiting. And so we know there's an urgency for us to get started. But as you noted, it really literally is a startup within government. So starting from almost from scratch. So about our structure, we are stood up inside of NIH. And so that means from day one, we are able to have all the things you need to run a business, like payroll and having people, be able to support your HR and get you on board. That was a really critical function. IT, get you a computer. And so, we're so grateful for just those very basic functions. So we could focus on hiring those program managers, which has been our priority. And I know we'll talk a little bit more about program managers as we go in there. But the other important thing for after I was sworn in on October 11th of last year was really making sure that we locked in our authorities that really make us different from the rest of HHS. And so I spent a lot of time in my first months with members of Congress, making sure they really understood what were the uncompromising things that we had to protect about ARPA-H. And so was really excited to see the omnibus that was completed at the end of last year by the Congress to lock in our authorities. And so part of the authorities that were locked in there was, yes, establishing us within NIH, but as an independent agency. And I report directly to Secretary Becerra. And so that's really a signal to, our independence and our ability to take big risks and have that independent decision making.
Yeah, I know that was one of the sort of the very early debates about, exactly how independent would be, but that's exciting to know, especially with sort of the cutting edge of what you're being involved in. In terms of the program managers, though, because, as I've had folks from DARPA and IARPA on the show several times now, and usually, they're involved in a program, and it usually dates back before them. They usually have sort of a limited time frame, so you don't get stale, but you're working really on the bleeding edge. Talk a little bit about sort of what you're looking at, because I see the calls out there. We're looking for project managers. What exactly is the ideal ARPA-H project manager look like, and what types of things you look at? Are you looking for them to come in and say, "Hey, what do you want to work on?" Or here's what we're going to work on, propose something.
So I think you hinted a little bit at the structure that's important to know. So these are term limited appointments. So through the omnibus legislation, it's a base agreement of working with somebody for 3 years, renewable for up to another 6. And so this is a term limit of, it's similar in time as DARPA, but these are folks that are not only excellent doers in their field. It's okay if they switch fields, but they should have demonstrated expertise, but also just this passion for solving a big problem in health. And so we're looking for people who can think like a CEO, but they're bringing the problem forward with us. And so we get the question a lot, what specifically are the programs that ARPA-H is going to fund? We can talk about big areas in science that we're excited about, but it's those program managers that from the bottom up bring those very specific problems that they want to solve. And so that's why it takes a little bit of time to bring those people on board, because you're not just looking at, an amazing person, but you're helping them develop their idea. And we do this through the Heilmeyer questions. And so as you've had other folks from ARPAs on your podcast, you'll know, George Heilmeyer was one of the directors of DARPA who set a framework of 8 questions of how do you communicate the problem that you're trying to solve. And this is really, what are you trying to solve is the first question, and describe it without any jargon so the whole world understands. How is it done today? What's the status quo? And then what's new in your approach? What's the big insight that you've seen as a program manager that you're so excited about doubling down on to make sure that this is helping to translate something into the real world? And then a couple of tactical questions. How long is it going to take? How much is it going to cost? What are the interim measures of success? What are the risks? We've added 2 additional questions for ARPA-H. And so one new Heilmeier we've added is, how are you going to make, if this is really a breakthrough in health, how are you going to make this accessible? How are you going to think about cost at the beginning of your program? And then actually user design and customer experience. So we want folks to actually want to use our technologies. That's how it's going to exist in the real world. So think about every medical interaction you've had in your career. I know not all of them were good. And so how do we actually make some of these tools that are going to be really, really useful for folks? And then finally, the last question we've added is just around, communication. How can this program be misunderstood or misinterpreted? And so, I know from a career in biotechnology that there can be a lot of misunderstanding about what a technology can or cannot do. And so we actually really need to be proactive about that. And so that's part of the interview process for a program manager. It's who are the people that are really passionate about, solving a big problem in health, but can also articulate a plan of how they're going to solicit and look for those solutions and teams in the real world who can actually make it happen from academia and industry.
And, in 2021, there were the White House Office of Science and Technology Policy held a variety of these listening sessions, and I was sort of going through the notes on these. It seemed like everyone possible showed up to voice their input on what ARPA-H should focus on. And you basically narrowed it down to these 4 baskets, which pretty much contain everything that has to do with health. So you have your health science futures, which basically the most, sort of the bleeding edge technologies and, that you could think about, scalability, proactive health, which takes into the sort of the prevention aspect, and then resilient systems, which brings everything else in, social determinants and climate change and economics. So I guess everyone had input, and you're really focusing on everything. But seriously, take us through a couple of these, if you would, and sort of what you see, sort of the short term. I mean, some of these obviously, may take a little longer than a single program manager period, but please.
Yeah. So, absolutely taking in the inputs from the listening sessions, but also the communities that we were talking with as we were standing up ARPA-H. Those 4 categories came about as, really defining a few buckets where we think big investment from ARPA-H can actually, advance the state of the art and change the course of a field. And so we aren't going to be a disease-specific organization. There's a lot of other places in the federal government that are doing that. It's not to say we won't have projects on diseases, but, we won't have a disease-focused office. And so that health science futures is really, what are the tools and platforms and technologies that we need to build, whether it's the next molecular platform or the next device going forward. But that maybe we fund 4 or 5 teams, and each team has a proof of concept in a different disease area. That is going to be completely the type of scope that we would have, at ARPA-H. And even better, if we can show that a given technology is useful for more than one thing, there's going to be pressure downstream for policymakers and regulators to really think about, how to address this and pull this forward going, beyond the end of the program. The other technology in product focus areas, as you mentioned, proactive health. So not only, detection and diagnostics, but what are the behavioral sciences that we want to address? There's so many preventable diseases. How do we start to address that and turn that into a program? And scalable solutions. So I came from the gene therapy field, and there's some really incredible proofs of concept of technology, but it is just absolutely unattainable because of cost for scaling and delivery. And so there's some big innovation there that we can really get this to more people, as just one example. And so you mentioned almost scope is to cover everything, and it's kind of meant to do that so that we don't want any audacious idea in health to feel like they won't have a home at ARPA-H. We really want to make this big. And so I've discussed some of these product innovation areas, but the last office, resilient systems, is really, how do we saw during the pandemic, our health system is not as resilient as it could be. And so how do we build resilience into that system? Is it, taking existing technologies and integrating them together. So this isn't fundamental, very early stage proof of concept in a laboratory. These may be technologies that exist already, but we need to bring them together under a digital layer, for example. And so I think there's actually a lot of innovation, especially in the digital health space, that is ripe for probably some early wins at ARPA-H.
How does, I mean, I know once again it's early days, but the guests for the most part that I've had from DARPA and IARPA have been focused on on biotech products and brain computer interfaces and so forth. And I know typically, those models they look for private sector and academic labs to work with. Do you think there's going to be any sort of cross fertilization between the other ARPAs because of they're used to working in the model already? But is there going to be anything along those lines or?
Absolutely. The broader world doesn't know the ARPA model. And so, we are getting a lot of interest from folks who've had prior ARPA experience. So, myself included. So I came to ARPA-H because I saw that model and I saw it work and, really inspired to create change. And so we are seeing some folks that want to work with us either as contractors or as federal employees that know what right looks like on the ARPA side of things. And so that's been pretty exciting going forward. But then even, more so talking with DARPA, I went to one of the DARPA Forward events that was here this fall. So DARPA had a series of events across the country where they just want to share their model, but also bring in stakeholders that are be part of their community. And so, we are definitely a stakeholder. They are our stakeholder. We want to make sure that we're not being redundant in our investments. And so, DARPA has a big D in front of DARPA. They are defense focused, which is going to be a different scope than us. But that said, some of the early investments by DARPA, there's no reason that we can't capitalize on those. And so, some examples that you mentioned 1,000 molecules program. And so that program was really focused on biofoundries and using microbes as a way to, ferment and produce new products. But we are dozens of years away from being at that capability with mammalian cells, as an example. And so even taking inspiration from some, DARPA type programs might be a path forward for us at ARPA-H to pursue those health futures.
Excellent. What do you think of some of the other organizations that we see popping up around the world that are trying to ARPA? I'll call ARPAization. I'm thinking of the Wellcome Trust and the Wellcome Leap Group, which has an ex-DARPA person there now. But when I was talking to Victoria Coleman from at the Air Force, on an episode a couple of weeks ago, she was like, "No, ARPA is specific, but who knows? What do you think about people trying to mimic it?"
Yeah, I mean, for ARPA-H, for example, we aren't here to replace anybody. We're here to augment that ecosystem. Sure. And for any space, any ecosystem that is in need of that catalyst that can take those big risks that nobody else can take, I say, honestly, the more the merrier. It can seem like there's a lot of ARPAs taking place because that model just works. Having a decision maker who acts as a CEO inside of government, who's able to, take big risks and make quick decisions is really unique, and I think is proven successful. Right? DARPA has examples of GPS, stealth technology, internet. What are those things going to be for ARPA-H? I don't know. President Eisenhower didn't know when he stood up DARPA that was going to be what came out of it. But we want to create that culture that allows for that innovation. And I think as a society, given the challenges that we're going to face, whether they're social, economic, pandemic, climate, we're going to need some really new ways to create some of those innovations beyond what we have now.
And, one of the, it was interesting because, you mentioned that ARPA-H is not going to have a disease-specific focus, but I think it was the July 2021, one of the listening sessions where you had the National Institutes of Aging folks there. And, there's one of the hot topic for us has been sort of this whole area of gerosciences about, instead of focusing, as the pharma industry is always focused on sort of specific disease outputs, can we look upstream to sort of targets that, may not be disease specific, but aging impacts a lot of stuff, whether it's dementia or cancer, heart disease, what have you. Any undercurrents sort of in the geroscience, longevity space, any themes that may be popping up on that front, or is it a little too early to say?
It's a little too early to say, but anybody who offers a specific area that they're really excited about, and this can go for your listeners too. If there's an area that you're really excited about ARPA-H funding, I encourage you to think of one or two people in your network who are, ARPA thinkers that can act like a CEO of a program, that aren't afraid to move a big bank account to, change the direction of a field, and are willing to come, serve their country for a few years and do this. And so if you're excited about aging and that space and completely in scope, I'm getting up there in age more than I was a few years
Me
ago.
too.
And so, yeah, right. So there's a lot of innovation to be had there, and would really welcome ideas and concepts and program managers that come in that space.
Cool. Um, Unrelated to health, but staying with biosciences for a moment, when I was doing my sort of background research on you, Renee, I noticed one of the things you're involved in. You're on the, I think, the board or the scientific advisories to the Revive and Restore organization, and I had Ben Novak on the show several months ago talking about their work. And I was checking out your Twitter, and you have a picture. No, you actually have a stuffed image of the black-footed ferret. One of the most endangered creatures in the world. And I was just wondering, I know you're not going to be working on this stuff at ARPA-H, but is that the creature that you're most interested in preserving? And what do you think of George Church's recent announcement to bring back the woolly mammoth?
Yeah, so I had to step down and on my board, so I'm no longer on the Revive and Restore board, but
Okay.
my the reason that I joined that board was, somebody, I'm sure you know the organization, the origins of that organization, Stuart Brand and Ryan Phelan, who are huge thinkers on the environment, but really just recognizing that with the pace of change that we're going to have to deal with for things like climate, there needs to be a new solution, and they're proposing a genetic intervention,
Right.
which is really provocative, and I think an incredibly powerful tool that we could use in that domain. But moving forward, absolutely have to think about consequences, intended or unintended, that may result from those technologies, and you can kind of proactively build in the design of those approaches to mitigate risk. It's not going to be totally risk-free, but how do you mitigate that risk as much as you can? And so I was really excited when I was invited to participate, because tools like gene editing, I don't think CRISPR's met an organism it can't edit, maybe even those that are extinct. And so how are we going, really linked in for me with safe genes and the way that we wanted to, push out gene editing technologies in the safest way possible. And so it was something I really wanted to offer to that community. And so, black-footed ferret is a really great example. It's interesting if you're familiar with their approach. So trying to optimize biodiversity. So we are losing biodiversity on this planet all the time. And so, there's some movements you probably have heard of, there's been the Human Genome Project, but what about the non-human genome project, and trying to really catalog, not only catalog, but harness a lot of that genetic diversity. And so Revive and Restore is, one example of an organization that is really pushing to do that.
Yeah. No, I just thought it was another cool part of, sort of your bio. And again, connecting human health to, there's much more out there besides us that we got to keep healthy to keep this place going.
Yeah.
So I thought it was a cool thing. Renee, I know we're coming up against a hard stop and you got a lot going on, but I just, ARPA-H has been set up. You're hiring the program managers. Anything else in terms of sort of the public facing initiatives that are going to be happening in the next couple of months, conferences you're going to be presenting at, places that we can run into you, listen to you, anything else happening in early 2023, please?
Well, we're going to be celebrating our birthday here in March. So
Nice.
1 year since the president, announced his intent to launch ARPA-H. So look out for some, at least birthday cake, if not some announcements. And we want to catch people up. Like, what have we been doing in this last year, and kind of demonstrate that we've been really working as hard as we can. We know the patients are waiting. I saw this recently. We went for a visit to a potential partner, and this has just really made an impression on me. And the patients are waiting. We're really moving as fast as we can going forward. In terms of other engagements, I think I'm at Aspen Health coming up in June.
Okay.
If those are the days. So I think that's the next big one on the calendar. And South by Southwest, I'll be there.
Sure. Awesome. Well, I mean, I know everyone's really excited about ARPA-H, about you leading it, and just really wishing you the best with this. And we'll definitely have to do a follow-up, say 6 months down the line when things are chugging along. But really great stuff. For everybody that's going to be listening to this particular episode of the show across the podcast or watching on the YouTube channel, again, you've been listening to Dr. Renee Wegrzyn, the inaugural director, Advanced Research Project Agency for Health, or ARPA-H. Renee, again, thank you so much for taking the time to come on and brief us about what's happening, and really wishing you the best with the organization as you move it forward.
Thanks, Ira. Really appreciate the time. And I'll let you know how many program managers reach out after this show. So thanks for getting the word out.
Will do.